Okay, so yeah, I'm Katherine Douthit. I'm a pediatric endocrinologist that practices locally at Children's Healthcare of Atlanta. And today I'm going to share a QI initiative that I worked on last year on improving the transition from pediatric to adult care process in our outpatient diabetes clinic. So first, why should we care about transition? Well, the transition from pediatric to adult care period, especially for our patients with diabetes, is a particularly vulnerable time. Not only during this time are they at risk for worsening glycemic control, but also increased risk for acute complications like ED visits for DKA, as well as this is when we start to see the emergence of chronic complications associated with poor diabetes control. So guidelines, let's see if this is going. I'll use the computer. So guidelines recommend early and structured transition planning, but in practice, this doesn't really happen consistently. I definitely thought that this was an issue that needed to be addressed at our clinic. And at our clinic, so we had just started implementing a kind of structured transition to adult care process, but didn't yet have any standardized way to document that process. So my first goal wasn't to, tackle improving our transition process overall, but I felt that we needed to start with a structured documentation tool to allow for future QI initiatives to be, more easily trackable and how effective they were. So I have some background with the electronic medical record system and helped build a tool for providers to document their transition discussions. And then I used PDSA cycles to track how often providers were using the tool and tried to increase tool use with a goal of at least half of our patient visits for patients 17 years and older with diabetes having the tool completed. Over the course of a year was the goal. So again, this took place at Children's Healthcare of Atlanta at our outpatient diabetes clinic. It involved patients 17 years and older with diabetes. I first started collecting data at the end of 2023 for some baseline data before the tool was released, and then released the tool and had my intervention period from January to December of 2024. My primary outcome was the percent of established diabetes visits for patients at least 17 years and older, where providers had interacted with the tool at all. And then I used the EMR to track tool usage, which was its primary purpose, but also for clinical and demographic data collection. I used run charts to track my progress. I distributed surveys to gather feedback from providers based on both on how they felt about the tool, but also on feedback on barriers to use throughout the QI initiative. And then I used odds ratios to compare PDSA cycles and chi-squared analysis to look at how different patient characteristics were associated with whether or not providers use the tool. So hopefully you can kind of see this. I realize it's maybe small on the screen, but the tool itself was a smart form, which we placed in the part of the chart where providers spent the most time charting during their visits. And then later on, during the project, I added a smart text which linked the contents of the smart form directly into provider notes. And then we also added a scheduling track board reminder in clinic, which flagged patients that were eligible to have the provider start documenting transition planning. All right, so at baseline, before the tool was released, I found in free text that only about 1 in 5 visits for patients 17 years and older with diabetes did providers document discussing transition at all. which wasn't too surprising. I collected data from the patients of about 30 providers in clinic and looked at, in total, about 2,200 encounters for 1,100 unique patients throughout the year. Providers identified time constraints, unsurprisingly, as the main barrier to using the tool, but overall, the tool is pretty well received in terms of its usability. And then here's my run chart. So when the tool was first released in January, there was decent use of it. About 25% of visits were the providers using the tool. In February, I demonstrated the tool visually at a provider meeting and then distributed that satisfaction survey. In May, I revised the tool based on some feedback that I received from providers, adding some readiness assessment questions for them to, interact more with the tool and maybe guide the transition planning topics being discussed, and then demonstrated the tool again at a provider meeting, at a divisional meeting. And then August, I reminded providers again at a division meeting, but also distributed the survey on barriers to use and gathered additional feedback on how to improve how often people are using the tool. And then ultimately in November, I made the final revisions to the tool and added those reminders I showed earlier to the scheduling track board and pulling the tool into clinic notes based on provider feedback. So here is just odds ratios showing, comparing the PDSA cycles. So you can see that there was unfortunately a significant reduction in odds of tool completion from cycle 1 to cycle 2, and then a non-significant upward trend in tool use across the remaining cycles throughout the year. And then here is where I looked at how patient characteristics were associated with whether or not providers completed the tool. And unsurprisingly, I found that patients that were at least 20 years of age or older, and then patients that had at least 3 clinic visits throughout the course of the year were more likely to have the tool completed. I did find non-significant trend for the tool being less likely to be completed for non-English speaking patients, as well as our patients with atypical forms of diabetes. So this included all of our patients with diabetes, including, like MODY and CF-related diabetes. So ultimately, while I didn't reach my goal, I did create a structured documentation tool for planning transition discussions where none existed previously. And I think my findings support, at least at our center, the need for a dedicated role to guide the transition planning process to better support our patients with transitioning to adult care. Okay. And I'd like to thank Dr. Cosson, my mentor, who helped a lot throughout this.
Yeah. Thank you so much for that talk. I have a twofold question. When you say smart form, how does that how does the user interface with that? Like, does it pop up? Do they have to go to a specific tab, or like, where is it in their Epic?
Sure. So it's on a tab called, it's on the this visit tab where the provider would be ordering medications. It's where we enter, when the patient's going to follow up next, all of our discharge instructions. So it's where the providers are spending most of their time, and we put it at the very top. And it only showed for patients that had a diagnosis of diabetes that were at least 17 years old.
And I couldn't read. Do you mind just saying what some of the key things in that smart form were? Because I couldn't see all of the
Sure.
things.
So
Thank you.
we kind of decided based on ADA guidelines, as well as other national guidelines for just chronic diseases, on some of the most important skills we thought patients would need before transitioning. So it says Do you know where your pharmacy is, how to call and ask for refills? Do you know what to do when you're sick in terms of ketone management, when you have hypoglycemia? And then let me think, what else did it? Oh, if they know their medications and their medication doses. So very basic things that we felt they needed to be able to do. Yes.
Oh, okay. Hi, Christy Caroli with Grady Health System. Since you said it was less likely to happen in patients that were seen less often, and one of the barriers was provider time, do you think this is something that could be done as part of pre-visit planning, maybe in chunks, just when you're calling for reminders or something similar?
Yeah, definitely. I think that that could be a good time to gather some of the information about, if they've identified a provider, who it is, when they plan on transitioning, all of that stuff's at the top of the form. We had also just started this teaching program that our CDEs, our diabetes educators and social workers, were implementing on teaching, all the skills that patients need before transitioning. But we didn't have a process for documenting that. So that was part of this documentation tool as well.
Hello, thank you for your presentation. I'm Nana Jones, pediatric endocrinologist at Cincinnati Children's Hospital, and to my left is Andrew Welch, who is an adult endocrinologist at University of Cincinnati. So it's literally transitioning from me to him. So we have very robust tools for transitioning. We use the Ready 2.0 developed by Sarah Carruthers at University of Cincinnati Children's. And we use it patient-reported outcomes, so the patient's actually filling it out, and then it pops into our EHR. But Andrew and I still struggle to get the patients successfully transitioned. So do you have data on how many successful transitions you have with this tool? Because like I said, we have a pretty robust system and we still can't get them.
So that was my next goal with tool use, because another part of the feedback that I got from providers was they were like, so what? Why is this needed? But my hope was that if we gather where patients are transitioning to, we could, hire somebody that can help confirm that they are indeed, being seen by that adult care provider, and seeing if this transition planning education program that we're implementing is having any effect. I also wanted to start implementing the readiness assessment survey. I got that, but we needed to start somewhere, and that was with documentation. But I'm not sure how successful we are right now, honestly.
Okay, and thank you. We have time for, unfortunately, only one more question. So Dawn has a question on Zoom.
Okay, thank you very much, Mary. We have a question from Jennifer Inger. She asks, aside from time constraints, any feedback from providers, maybe anecdotal, on what would make them more likely to use the form?
So I asked for if they had a hard time locating it, if they didn't know what patients should have it completed for, if they thought it was important. So some of the feedback I got was that they just forgot, which is why I implemented some of the different reminders in the EMR. A few said that they weren't sure when they should be filling out the form. So that's that banner at the top that is in red trying to explain, when it's appropriate to complete the form. Hopefully that helped. There weren't any other anecdotal feedback that I can remember.
Thank you.